Hello, we will talk today about an important syndrome is the EPS or the anti-phospholipid syndrome. My name is Muhammad Ashraf Salah and my supervisor is Dr. Inji Badawi. And this is my outlines today. Firstly, what is the definition of EPS or the anti-phospholipid syndrome? Antiphospholipid syndrome is an autoimmune disorder or autoimmune disease characterized by arterial and venous thrombosis, adverse pregnancy outcomes from mother, and raised levels of antiphospholipid antibodies. So what is the story of these antibodies? These antibodies attack the phospholipid in the cell membrane of their own cells. Means that this syndrome is an autoimmune disease. EPS could be classified into primary EPS that occurs by itself or secondary EPS that occurs with other autoimmune diseases, especially systemic lupus erythematosus (SLE). There are some genetic and environmental factors of EPS, but the exact cause of EPS isn't known yet. For example, the main cause in the genetic factor, the HLA-DR7 gene, encodes a specific type of protein called major histocompatibility complex or MHC class II, which sits on the surface of the B cell. This surface protein helps activate B cells so that they can start producing antibodies against self, and that is the point. The main damage of the all autoimmune diseases, not only APS. Now, having a mutated HLA-DR7 gene predisposes individuals to activate B cell production of antiphospholipid antibodies, but presence of mutated HLA-DR7 alone isn't enough to develop antiphospholipid syndrome. An environmental trigger must also present. Some factors or triggers like infections or drugs. Infections like syphilis, hepatitis C, HIV, and malaria. Like we say, drugs like cardiovascular drugs or antipsychotic drugs. Antiphospholipid antibodies. The main antiphospholipid antibody is anti-beta-2 glycoprotein 1, which targets the protein beta-2 glycoprotein. This protein binds to phospholipids and inhibits aggregation, which is when platelets clump together to form blood clots. So when anti-beta-2 glycoprotein binds beta-2 glycoprotein 1, it is not free to do its job, and that led to clot formation. Another antiphospholipid antibody is anti-cardiolipin, which targets the lipid in the inner mitochondrial membrane called cardiolipin, which binds beta-2 glycoprotein 1. Anti-cardiolipin antibodies are also present in syphilis, and can cause a false positive in the test for syphilis. Autoantibodies might also target blood component. If red blood cells are targeted, it can lead to anemia. And if platelets are targeted, it can lead to thrombocytopenia. So, the antiphospholipid antibodies lead to a hypercoagulable state, meaning that they cause the thrombosis or blood clot to form within arteries and veins. Okay, what is the symptoms? Arterial thrombosis is more common in males and can cause a heart attack, stroke, or limp. Venous thrombosis is more common in females, presents as deep vein thrombosis. Organs can affect it. Organs with small capillaries is the kidneys, cause renal failure because of thrombosis. And women affected by antiphospholipid syndrome tend to have pregnancy related complications that lead to miscarriage that can occur due to thrombosis leading to placental infarction. Also can cause neurologic symptoms like headaches. In rare cases, antiphospholipid syndromes lead to rapid organ failure due to generalized thrombosis. This is called catastrophic antiphospholipid syndrome and can lead to death. Diagnosis of EPS requires at least one clinical and one laboratory diagnostic criteria. There are two clinical criteria: history of thrombosis and pregnancy complications, and there are three laboratory criteria are presence of anticardiolipin, anti-beta-2 glycoprotein antibodies, and lupus anticoagulant in blood. Some medications will talk about the role. Treatment of antiphospholipid syndrome is aimed at preventing thrombosis. Our first medication is aspirin, and the role is inhibition of platelets activation. How aspirin works? So when platelets is become activated, arachidonic acid is released from the membrane phospholipids, then it gets converted to prostaglandin H2 by cyclooxygenase 1 enzyme or COX1. Finally, prostaglandin H2 is further metabolized to thromboxane E2, which released from the platelet to stimulate activation of new platelets as well promote their aggregation. So what aspirin does? It irreversibly inactivates COX1 or cyclooxygenase 1 enzyme, this effectively disrupting clot formation. So aspirin is aggregation inhibitor drug. People who have had a blood clot should also take warfarin as oral anticoagulant therapy, but during pregnancy, warfarin can close the placenta and have a toxic effect on the fetus, so must replaced by low molecular weight heparin. So we want to prevent coagulation that causes by antiphospholipid syndrome. Let's focus. The medication low molecular heparin binds to the inactive antithrombin. This binding causes a conformational change and activates antithrombin. This in turn accelerates the interaction between the active antithrombin and factor XA or A10X, leading to decrease of prothrombin to thrombin, which further inhibits fibrinogen to fibrin and simply prevents blood clotting. Okay, fast. So antiphospholipid syndrome occurs when your immune system mistakenly creates antibodies that make your blood much more likely to clot. This can cause dangerous blood clots in legs, kidneys, lungs, and brain. In pregnancy, women with antiphospholipid syndrome also can result in miscarriage. Finally, there is no cure for antiphospholipid syndrome, but medications can reduce your risk of blood clot. No more to be perfect. And thank you.